Mergers and acquisitions, or closing and consolidating, are activities that healthcare practices undertake at a variety of times in the life cycle. So you might be expanding your practice, or you might be downsizing your practice. You might be buying or acquiring an existing healthcare practice to rapidly expand the scope of your services, location, or space. Or maybe you're merging multiple practices into one more streamlined practice so that you can better manage your margins. You might be looking to diversify your services, or perhaps create an area of super specialty that will provide a competitive advantage for your healthcare practice. You might be wanting to acquire skilled employees or healthcare providers that you couldn't recruit under your current circumstances. You may be acquiring or consolidating real estate, infrastructure of medical equipment, electronic medical record, computer networking, perhaps the management structure, or you are exploring opportunities for economies of scale or cost cutting. Today, we will review the important steps for you to consider before you finalize the deal, and to plan your next steps to update your privacy impact assessments.
Welcome to Practice Management Nuggets Podcast, practical practice management and privacy tips to help you start, grow, and improve your healthcare practice. If you are a clinic manager, team lead, healthcare provider, or practice owner, these practical tips will save you time and money. My name is Jean Eaton, your practice management mentor and your practical privacy coach with Information Managers. I help you manage the pink elephant in the room.
Now, just a reminder that I'm not a lawyer and I don't play one on TV or even on a podcast. These are my resources, my responses to you based on my research and experience.
Let's get started.
I strongly suggest that you make sure that you have professional expert advice and support for areas of change management, accounting, legal, real estate, and human resources. A communication plan is critical for your current staff and your new employees in your new organization. Make sure that you've addressed a communication plan that identifies the organizational leadership so that there's a clear succession plan in place and that everybody understands what that is. You need to make sure that you've got an IT leadership, and that might be somebody who is internal or an outsourced service, or a combination of both. Also, make sure that you've got a good clinical leadership communication plan. When you are consolidating or expanding your services, you need to make sure that you have those standard operating practices and those accreditation and certification processes in place to ensure that you're working properly within the scope of your practice and that you are meeting those clinical best practices. Having a communication plan is critical. Naming somebody who is responsible for ensuring the communications and an alternate person is definitely a good strategy. You need to have named somebody who is responsible or things won't get done. Make sure that the communication plan includes all of the individuals involved. So at different stages, you will include the different management teams, the employees, the vendors, your stakeholders, and your patients. Make sure that you understand what your communication channels will be, whether it's by email or bulletin board or text messaging or a website. So a communication strategy is going to be critical to the success of your mergers and acquisitions. Specifically, I want to talk about the things that you need to know before you merge that's going to assist you with making sure that you have your privacy compliance and your privacy impact assessments in place and up to date. So we're going to talk about 5 things that you need to know before you merge. You need to inventory all of your existing patient records. You need to make sure that you understand the history and your current patient record systems. Make sure that you have all of the agreements, existing documents, and a privacy impact assessment amendment plan. So let's take a look at each of these steps in turn. So the first step is to make sure that you have an inventory of all the existing patient records. So remember that you have to meet the records retention period, which largely is 10 years plus the age of majority. So make sure that you are meeting the records retention periods, and make sure that you have correctly inventoried all of the patient records. So this includes all of your paper records, all of your store records that are in storage, things that have been backed up to an electronic drive or a separate memory device. Make sure that you have all of those pieces of information. If your healthcare practice that you're acquiring started with EMR vendor number A here and then migrated to EMR vendor B, make sure that you have all of the patient records for both EMR A and EMR B. The patient records includes your scheduling information and your billing information. So be very clear and be very thorough about what are all these existing patient records. Oftentimes, one person doesn't have all of this information. So make sure that you're talking to all the different people in that organization. So you might be starting with your healthcare providers, your clinic owners, if they're different people, the clinic manager, and talk with the employee that's been there the longest in your organization so that you can get that corporate history and identify where all of those patient records were. Really stir the pot on this one. Talk about when did the clinic first get started and how did you manage patient records at that time? Were you using paper books? Were all of the paper records stored in the clinic, or are they stored in somebody's basement or garage? Ask a lot of leading questions, and you may be surprised that the first response about, oh, all of our records are in the EMR is not as complete as you might thought it was to begin with. I often find when I'm asking clients about records for patients, they have spotty memory. So when you ask more and more questions, you go, okay, at this point you did this, and what did you do before that? Oh, I forgot. I just remembered. This is something else that we used to do. So ask a lot of questions from a lot of people. Make sure that you have a really thorough understanding about where all those patient records are. Which leads to number 2 is the patient record systems. How were the records maintained during that time? And make sure that you have this well documented. So I like to have a table that provides a time span of the records. When did the clinic open? And identify all of the different time spans. From this time to this time, we had paper records and we used a paper scheduler. Then we moved to an electronic system for our patient appointments, but we still had paper records. And then also identify what is the current status of those systems. Is it current? Is it archived? Hasn't been deleted or destroyed? When you're looking at patient record systems, you also need to take a look about what is the current patient record system. And you're going to get into the details about termination clauses. So if you are acquiring a new business and you are now all going to make a decision to move to one EMR system, identify what are the termination clauses for each of those EMR systems and each of those billing systems, because that's going to help inform you to make a decision about which way that you want to move forward as far as costs. Now, many EMR systems will charge you a fee to be able to provide the information in a read-only version. So if you're not continuing with updating information in that EMR system, but you still need to have access to the previous system to be able to read those records, you might want to think about purchasing a read-only version so that you have the software as it is today when you completed that transaction with them. You're not updating it. It's no longer on the internet, so that you can read all of the patient records at a point in time. So often EMR systems will charge you to do that so that you have that read-only access. They might also charge you to export the information into a readable format like a PDF format. Now, a PDF format of patient records is typically not the complete record. A PDF format will give you perhaps the clinic notes, but it may not include the tasks or the imported lab results or the attached pictures that you've taken for that patient. It largely does not include the audit logs. And All of that information is part of a complete patient record. And by legislation, you must keep the entire complete record. So oftentimes a PDF an export to a PDF is not good enough. Maybe it is helpful to be able to export it to another EMR system, but you probably still need to have a read-only version of your health record system as well. So make sure that you have a very clear understanding about what the termination clauses are as far as a cost. Some systems charge more than others. And what is the data migration plan? So, and what is the quality assurance that you're going to do to ensure that you've got a good data migration plan?
You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live.
The third step is to make sure that you've got good agreements in place and that you know all of the existing agreements. So there should be an agreement, an information manager agreement with your EMR vendor, with your billing vendor. Is there an information manager agreement amongst all of the custodians in each of the practices? There should be. Do you have an agreement with a primary care network, with Alberta NetCare Portal? Have you identified successor custodian agreements? Are there pre-existing successor custodian agreements that need to be updated? So be very comprehensive about these agreements and specifically ask for each of these agreements for each of the organizations. So you're going to do a lot of data gathering. The fourth step is existing documents. So what are the existing documents that are going to support the business of managing those patient records? What are the policies and procedures that have been put in writing? So if they've had a privacy impact assessment previously, they submitted a policy and procedure set at that time. So get the policy and procedure set at the time that they submitted the PIA, say for example, that was in 2010, and then they updated their policies and procedures in 2016. Make sure you get both sets of those policies and procedures and whatever the current policy and procedure is as well. So oftentimes I will consult with clients and they'll say, oh, we never did one. But if you did a privacy impact assessment previously, you did have a policy and procedure set. You had to, because that's part of the PIA submission process. So if the person that you're asking doesn't know, go ask somebody else. Go take a look on the shelves of the clinic manager's office or the physician's office and thumb through and find those policies and procedures. Maybe you've got an electronic copy of that. That would be ideal. So make sure that you've got all of those documents, both in paper and electronic format, so that you know what you've got so that you can plan your next steps. Which is number 5, a PIA amendment plan. So we're going to take a look at this in a little bit more detail. So you want to be thorough about understanding those current documents and then map what you're going to do as a go-forward plan. So we want to take a look at the risk assessment as well. So if they've had a privacy impact assessment previously, they should have a previous risk assessment. Make sure that you pull that out and review it. So as a reminder, you want to make sure that in your risk assessment that you're looking about what are all the bad things that could happen and what is the likelihood of things if it did happen, if you didn't have any mitigation strategies. So if it did happen, how bad would it be? You're going to take a look at a variety of different vectors or different types of risk. So there may be a threat with unauthorized external access, unauthorized internal access, authorized external access, or unauthorized internal access. So you're going to take a look at physical, administrative, and technical risks for each of those different vectors. So you get a very comprehensive look about what the risks currently are in the organization, how they're going to be mitigated. And then that's going to help you leverage that to plan for your PIA amendment. So if, for example, you are going to acquire another health practice, and one of the physical risks is that somebody could walk into the clinic and access the clinic without a key, or with a key. And now you have acquired that clinic and your employees have changed, the ownership has changed. Have you changed the keys on the locks on the doors? So you still need to go through and assess what those risks are currently and as a go forward plan. So to make sure that there are no loose keys that have been given to janitors or previous staff that are circulating that you don't know about, you want to make sure that you're changing the lock on the doors so that you can be thorough about understanding where your risk is. You know that you're managing all of the current keys because the locks on the doors have been changed. Make sure that you are addressing each of these risk descriptions that are specific risks to include in a health information risk assessment. So use this as a checklist for your risk analysis in your PIA submission and make sure that you're addressing each of these areas. For example, how many ways can you experience a breach of confidentiality? Well, of course, there's many of them. And how are they doing it in the current systems, and how are you going to do it on your go-forward basis? Remember, you're going to take a look at your mitigation strategies based on the 3 types of safeguards. So administrative controls, your physical controls, and your technical controls. Now, a PIA amendment takes a team. It will take a team of people that are part of the current healthcare practices and those teams that are going to help you transition to that new practice for you. So make sure that you are thoroughly understanding the documents, that you've done a really good job about gathering all of that history of documents, because you need to manage that retention period for 10 years plus. Then you're going to establish that mitigation plan. Then at the end, you're going to update or create that privacy impact assessment or that privacy impact assessment amendment. Now, this is a really important part about the valuation of the cost of that merger or acquisition or the downsizing of a practice. How big of a job is this going to be for your new plan? If the current practice has a PIA that was done within the last couple of years and your amendment isn't going to take a lot of work to be able to move that up to date, then the cost related for that is going to be much different than if you are acquiring a clinic that had their last PIA done 10 years ago and they've got a new EMR system and, oh, they didn't do a PIA. So you may have to do a brand new PIA to get their systems up to date and then be able to address that merger. So the understanding all of the information gathering is going to help you decide at the end of the day, how big is this PIA amendment plan? Is it going to be something that you can manage with a long cover letter and attachments? Or is this something that you're going to have to redo perhaps for multiple locations before you can even get to the point about being able to do that merger and that data migration plan? I'm glad that you are thinking now about the risks and the strategy to mitigate your privacy impact assessment, the privacy compliance requirements when you're merging or acquiring a healthcare practice. These are key steps, and you want to make sure that you've left yourself ample time and resources to be able to address this properly. When you have these things in place, it's going to make sure that your merger and acquisition for your new practice is going to be much smoother. It's going to be comprehensive, and you're going to meet your privacy compliance requirements.
For more tips to help you maintain your privacy compliance while you close, move, or merge your practice, download this Practice Management Success Tip. The Success Tip includes template forms for patients and template procedures, including patient record inventory, procedure archive and destruction log. Download these at informationmanagers.ca/PMSCM. I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.